Okay, so we're diving into addiction and mental health today.
Yeah.
You sent over some really interesting stuff,
Yeah.
and I can tell that this is something
Okay.
you're really trying to get a better grasp on.
Yeah, this whole
It's an area where there aren't a lot of easy answers.
yeah.
The connection between addiction and mental health is
Yeah.
it's complicated.
Yeah.
And it's not just about like two problems that exist at the same time,
Yeah.
but they each influence each other.
Totally.
Yeah.
And right away we see these terms like dual diagnosis and triple diagnosis. And
Yeah.
honestly, it kind of sounds intimidating.
Yeah, it can be a little intimidating, but it's not as
Yeah.
complicated as it sounds.
Okay.
Dual diagnosis is basically when someone's going through both a mental illness and a substance use disorder
Okay.
at the same time.
At the same time.
And triple diagnosis, as you might guess, is adding another layer on there.
Which is often, HIV or AIDS entering the picture.
And that's not like an insignificant number
No.
of people.
No, not at all.
The research here says about half the people who are struggling with a mental illness will also experience a substance use disorder,
Right.
and vice versa.
Absolutely. And
That's-
that kind of raises the question of
Yeah.
what's at the root of that connection?
Yeah.
Is this,
Is it a chicken or the egg?
is it a one causing the other, or is it more complicated than that?
Right.
And it's usually more than keeping that.
It can't be as simple as like, oh, anxiety always leads to substance use.
You're right.
Something like
It's
that.
rarely that straightforward.
Yeah.
The research you shared kind of highlights three main pathways, and sometimes it's a combination of them.
Okay.
The first is shared risk factors, so
Okay.
things like genetics,
Okay.
chronic stress, or even trauma earlier in life,
Okay.
especially during childhood.
Yeah.
These can actually create vulnerabilities for both mental illness and substance use disorder.
So it's like they have this underlying thing
Exactly.
that could make them more susceptible to both.
Exactly. It's like they have this sort of predisposition that
Yeah.
makes them
Makes them more likely to experience.
vulnerable to both.
Okay.
Now, the second pathway is a little bit more direct, where sometimes the mental illness might directly lead to substance use.
Okay.
Imagine someone struggling with severe anxiety or depression.
Right?
They might turn to drugs or alcohol as a way to self-medicate to cope,
Yeah.
even if they know it's not a real solution.
Right. They know that it's not actually helping in the long term.
Right. It's like this desperate attempt to find relief,
Yeah.
even if it ends up making things worse.
Totally. Yeah.
Now, the third pathway flips the script.
Okay.
It's where the substance use can actually trigger a mental illness.
Interesting.
So when someone uses substances heavily over time,
Right.
it can actually cause changes in brain chemistry that can make them more likely to develop a mental health disorder.
So sometimes it's like the substance use comes first, and sometimes it's the mental health challenge comes first.
It's not always a clear cause and effect.
Wow. Okay.
And one factor that really stood out to me from the sources you shared is childhood trauma.
Yeah.
There's a really strong link between adverse childhood experiences
Right.
and later struggles with both mental health and substance use.
That's so sad
It is sad.
to think about, but it also like really shows how important early intervention is.
Right.
And like
support.
systems for kids who are going through that.
Absolutely. Those early experiences can have a
Mhm.
huge impact on our well-being later in life.
Totally.
And you've hit on a really important point there. Early intervention is key.
Yeah.
But it's not the only thing to consider.
Okay.
Understanding that link between childhood trauma and these disorders
Yeah.
is also really important for developing effective treatment.
Right. Treatment shouldn't be like one size fits all.
It shouldn't be a one-size-fits-all approach,
Especially with something.
especially when dealing with these kinds of complex issues.
Yeah.
Yeah, it's about recognizing that everyone's journey is different
Right.
and that treatment needs to be personalized.
Okay.
And speaking of treatment, the material you shared really emphasized that there are effective therapies and medications available.
That's good to hear.
Yeah.
But it also sounds like we need to think about treatment in a way that
Right.
acknowledges that both conditions might be present at the same time.
Absolutely. You can't treat one without considering the other.
Right.
It's like putting a Band-Aid
Yeah.
on a much deeper wound.
Totally.
The research you shared really highlights the importance of this comprehensive,
Yeah.
integrated approach,
Especially with dual diagnosis.
especially in cases of dual diagnosis.
Okay. So it's not about treating addiction and mental health
Right.
like as these separate things, but really looking at them as interconnected.
Yeah, it's all part of a person's overall well-being.
Right.
One approach that is often brought up in this context is behavioral therapy.
Yeah.
And I'm curious from what you read, what
Yeah.
kind of stood out to you about that approach?
Well, I thought it was really interesting that these therapies can be tailored to an individual's
Right.
specific needs. It's
Yeah.
not just like a one-size-fits-all solution.
You're absolutely right. That individualized approach is key.
Yeah.
And just to give you some example,
Okay.
some common ones are cognitive behavioral therapy,
Right.
CBT, or dialectical behavior therapy, or DBT.
Okay.
These focus on helping people identify and change
Yeah.
the thoughts and behaviors that contribute to both
Right.
their mental illness and their substance use.
So it's about giving them tools.
Exactly.
To like give them the tools.
Break free from
Yeah, break free
use patterns
from harmful patterns.
and like learn new ways
And learn healthier ways of coping.
to deal with stuff. Exactly.
Okay?
They learn how to manage their cravings,
Right.
regulate emotions, and address any underlying
Okay.
psychological issues that might be fueling
Right.
both the mental illness and the addiction.
So it's really about empowering them
Yes.
to take control of their own recovery.
Absolutely.
And alongside these behavioral therapies,
Yes.
the research also talks about medication
Yes.
as an important part of a comprehensive treatment plan.
Absolutely. Medications can play a crucial role.
Okay.
The materials you provided specifically highlight medications for opioid, alcohol, and nicotine addiction.
Okay.
And these can be really helpful in managing withdrawal symptoms,
Right. Because that can be so hard.
which can be a huge barrier for people trying to get sober.
Right.
They can also reduce cravings
Wow.
and even address some of the underlying neurochemical imbalances
Okay.
that contribute to both addiction and mental illness.
So it's not just about like willpower
No,
or therapy.
It's not just about talking about it.
Yeah.
Sometimes medication is needed to really provide that stability
Yeah.
and support the recovery process.
Okay, so it's about recognizing that these conditions have
Right.
psychological and physiological components,
Mostly.
and treatment should address both.
Yes, and that's where a collaborative approach becomes really important.
What do you mean by collaborative?
So ideally, you'd have a team of healthcare professionals,
Okay.
therapists, psychiatrists, and other specialists all working together
Okay.
to create a treatment plan that really addresses that person's needs.
And that seems so important, especially when we're talking about like breaking down these silos between mental health
Exactly.
and substance use services.
It's about integrating those services.
Right.
Yeah.
But I'm curious, like, how does that happen in the real world?
Well, there are some innovative programs out there.
Yeah.
For example, some clinics offer what's called co-located services,
Okay.
where mental health and substance use treatment are provided under one roof.
That makes sense.
So it's easier for people to get both types of care
Right.
without having to go through separate systems.
And that removes so many barriers.
Exactly. It removes a lot of the logistical barriers.
Yeah.
And even some of the emotional barriers that people might face.
Yeah. And I imagine it also helps to reduce some of the stigma that surrounds these things.
You're exactly right.
Yeah.
Integrated care models not only make treatment more accessible,
Yeah.
but they also send a message that these issues are connected.
Right.
And they deserve comprehensive attention.
Okay.
It's about treating the whole person, not just isolated symptoms.
And this brings us back to something we talked about before about
Right.
societal attitudes.
Yes.
If there's so much stigma around these things,
Stigma can be a huge barrier to treatment.
it must make it that much harder to reach out for help.
Absolutely.
Yeah. It's like this vicious cycle where stigma prevents people from getting help,
Exactly.
which then just like perpetuates.
And then that just fuels the stigma even more.
Right. Exactly.
But there's some hope in your material, too,
Oh,
when it talks about community health workers.
yes. Tell me about that.
They play such a unique role,
Okay.
especially in communities that may have limited access
Okay.
to traditional healthcare services.
Yeah, they're filling like a crucial gap, it seems like.
Exactly. And community health workers are often people
Okay.
from the very communities that they serve.
Oh, wow.
So they have this deep understanding of
Yeah.
the needs and challenges faced
Yeah.
by those communities.
Yeah, because they're coming from within.
Exactly.
They can.
They can build trust and rapport
Right.
in a way that someone from outside might not be able to.
Totally.
They can act as bridges,
Yeah.
connecting people to resources,
Yeah.
providing education, and offering support.
Right.
That's culturally
Yeah,
sensitive.
it's so important.
They play such a vital role in prevention outreach and reducing stigma.
Their involvement highlights how we need to approach this from different angles.
Yes.
You know, incorporating like community initiatives and peer support
Exactly.
along with those.
Alongside the more professional treatment
Yeah,
options.
the professional treatment
Yeah.
options.
You're right. It's about recognizing that
Yeah.
we need this multi-pronged approach
Yeah.
to really
Address this complex interplay.
the complex interplay of addiction and mental health.
And the research here really stresses the need for that approach to be grounded in understanding
Yes.
and compassion.
Absolutely.
And that really resonated with me. It seems like we're really moving towards a more well-rounded way of supporting people.
Yeah.
Like we're starting to understand that it's not just about treatment, but also about making it okay for people to ask for help.
Right. A supportive environment is so important, and that's where reducing stigma
Yeah.
is so crucial. If we can create a culture where mental health and substance use disorders
Yeah.
are treated with the same compassion as any other health condition,
Right.
it would make a huge difference in terms of people getting help and recovering.
It's about realizing that we're all in this together.
Yeah.
Everyone faces challenges, and some of those challenges might involve these things.
Exactly. The materials you provided even talk about the importance of peer support networks.
Oh, yeah.
These networks can really help people feel like they belong and that they're understood.
That makes a lot of sense.
Yeah,
Sometimes the best support comes from people who've been there
exactly.
and can really understand.
Someone who's walked a similar path and can offer guidance from their own experience.
Exactly.
That connection can be so powerful. It can help people overcome those feelings of isolation and shame.
Right. And remind them that they're not alone.
Exactly.
This has been so eye-opening for me. I feel like I've learned so much about how addiction and mental health are connected and how important it is to be compassionate and focus on the whole person.
I agree. It's been a fascinating conversation. And, as we wrap up, I want to leave our listeners with a thought.
Okay.
We've talked about different treatments and ways to support people,
Right.
but it's important to remember that recovery is a personal journey.
Yeah.
It takes strength, resilience, and belief that things can get better.
And as we've talked about, that belief is something we can all help foster,
Ex-
by challenging those stigmas, promoting understanding, and advocating for care that's available to everyone.
Absolutely. It's about
Yeah.
recognizing that there's always hope, and help is out there. You're not alone, and your story matters.
Thanks for joining us for this deep dive, and we'll see you next time.